Okay, so today we're going to be talking about the cardiovascular system, or the heart. And so your learning outcomes today are to identify the two components of the cardiovascular system, summarize the functions of the cardiovascular system, and explain the purpose of the lymphatic system and circulation. So the cardiovascular system is made up of the heart and blood vessels. And the heart pumps blood through the blood vessels. So it's bringing nutrients to cells and it's helping get rid of waste, and exchanges of substances occur through the interstitial fluid. Okay, so here's an image here showing the cardiovascular system. You can see it spans through your whole body. What you need to remember is that red is carrying oxygenated blood and blue is carrying deoxygenated blood. Okay, so the functions of the cardiovascular system, one is for transportation, so of oxygen, carbon dioxide, and other waste products, and nutrients and hormones. Another function is protection, so the cells of the immune system are transported to help protect the body from infection. We have regulation to maintain homeostasis, a variety of the body's conditions, such as pH balance and electrolyte levels. And then the lymphatic system assists the cardiovascular system by collecting excess tissue fluid and returning it to the blood. And so when fluid enters the lymphatic vessels, it is called lymph. So the types of blood vessels, so for learning outcomes here, describe the structure and function of the three types of blood vessels, explain how blood flow is regulated in each of the three types of blood vessels. So there are three types of blood vessels. We have arteries, veins, and capillaries. So arteries carry blood away from the heart, and their walls have three layers. They have endothelium, which is the thin inner epithelium. They have a middle layer, which are smooth muscle and elastic tissue. And these allow the arteries to expand and recoil. And then there's the outer layer, which is just connective tissue. So here's an image here showing you an artery on top in red and a vein down here in blue. And what to note here is that there's a lot thicker tissue around the artery. Okay, arterioles. These are small arteries. So these are the middle layer, has mostly smooth muscle. It contracts to constrict the vessel, reducing blood flow and raising blood pressure. And when relaxed, the vessel dilates, increasing blood flow and reducing blood pressure. Okay, then the capillaries. These are microscopic vessels between the arterioles and the venules. And the walls of the capillaries are made only of endothelium. And these form capillary beds where gas, nutrients, and waste exchange can occur. And these have the precapillary sphincters, which control blood flow through the capillary bed. And so when closed, blood instead flows through an arteriovenous shunt. Okay, so here's a picture of that capillary bed. Okay, the veins to the heart, so the venules, these are small veins that receive blood from the capillaries, and veins carry blood towards the heart. And venules and vein walls have the same three layers as arteries, but less smooth muscle in the middle layer. And veins that carry blood against gravity have valves that keep blood flowing towards the heart. So the walls of veins are thinner than arteries, so they can expand to hold more blood. And at any one time, they store 70% of the blood. And if blood is lost, like through a hemorrhage, the nervous system causes the veins to constrict to increase blood volume. So the heart is located between the lungs, and it points towards the left hip and consists mostly of the myocardium, which is made of cardiac muscle tissue. Muscle fibers are branched and connected by intercalated discs, which contain gap junctions. And so these allows the cells to contract in unison. And they also connect by desmosomes, a type of cell junction that prevents overstretching by holding adjacent cells together. So that's imaged here. So here's tissue of the heart. You can see those intercalated discs. There's also lots of mitochondria, And then you can see the separation of each cell through these gap junctions. Okay, so the heart is also surrounded by a sac called the pericardium, which secretes pericardial fluid for lubrication. Internally, the septum divides the heart into right and left sides. And so this consists of 4 chambers, 2 upper atria and 2 lower ventricles. Okay, and so that's imaged here. So we have a right atrium, a left atrium, the right ventricle, and the left ventricle. Okay, so the heart concluded, there's 2 types of valves. You have the semilunar valve and the atrioventricular valve. So the AV valves are reinforced by chordae tendineae, and the left AV valve, or the bicuspid or mitral valve. Then we have the right AV valve, or the tricuspid valve. And then we have the semilunar valves, which the pulmonary valve and the aortic valve. Okay, so you can think of the heart as a double pump. Okay, so the myocardium needs its own blood supply. So we have coronary arteries that supply it. They are the first branches off the aorta. Then we have coronary veins that drain it, that empty into the right atrium. Then we have coronary artery disease, which is a blockage in the coronary arteries caused by a myocardial infarction or a heart attack. So blood flow through the heart. So this is an important slide here. So the superior vena cava and inferior vena cava carry oxygen poor, CO2 rich blood from the body to the right atrium. Then blood flows through the right AV or the tricuspid valve into the right ventricle. Then the right ventricle pumps blood through the pulmonary valve into the pulmonary trunk, which branches into right and left pulmonary arteries, and these lead to the lungs. Okay, so then the pulmonary veins carry oxygen-rich or CO2 poor blood from the lungs to the left atrium. Blood then flows through the left AV or bicuspid valve into the left ventricle. The left ventricle pumps blood through the aortic valve into the aorta. And then the aorta branches into smaller arteries, which lead to the arterioles, the capillaries, venules, veins, and back to the vena cava. Okay, so the cardiac cycle. First, the atria contract together, then the ventricles, then the heart relaxes. So we have a systole, which is the heart contraction, and diastole, which is the heart relaxation. And this occurs about 70 times per minute on average. And there are 2 audible sounds. We have lub dub. So lub from the closure of the AV valves and dub from the closure of the semilunar valves. And then if you have a murmur, this is a swishing sound between the lub and dub from regurgitation of blood or a leaky valve. So here's the stages of the cardiac cycle. So first, the right atrium and the left atrium contract, as you can see here by these little lines. Okay, then the atrioventricular valve closes to give you that lub sound. And then there's another contraction. And then the semilunar valves close to give you that dub sound. Okay, so there's internal control of the heartbeat. So the internal conduction system. So this is through the SA node in the right atrium, which initiates the heartbeat by sending out an electrical signal. This causes the atria to contract. So the SA node is also called the pacemaker. So this impulse reaches the AV node, also is in the right atrium. The AV node sends a signal down the AV bundle and the Purkinje fibers. This causes ventricular contraction. These impulses travel through gap junctions and the intercalated discs. Okay, so that's shown here, where you get electrical signals starting at the SA node, and it goes around and down and then around the heart. There's also external control of heartbeat. So the cardiac control center in the brain increases or decreases the heart rate depending on the body's needs. And also some hormones can increase heart rate, like adrenaline. Okay, so then electrocardiogram is a record of the heartbeat. So this is a recording of the electrical changes in the heart muscle during a cardiac cycle. So the atria produce an electrical current called the P wave, when stimulated by the SA node. Then you have the QRS complex, which is a wave of electrical current traveling through the ventricles. And these signals that the ventricle are about to contract. And then the recovery of the ventricles is represented as the T wave. So here's an image shown here of the P wave from the atria, and then the QRS wave through the ventricles, and then the recovery of the ventricles in that T wave. And so if you look at an image here of an ECG, you can see multiple heartbeats over time through this grid, and then you can get beats per minute. So for example, this is 78 beats per minute. Okay, so an electrocardiogram also could detect abnormalities, that is ventricular fibrillation, caused by uncoordinated, irregular electrical signals in the ventricles. So the heart can't pump blood, tissue becomes starved of oxygen. And so defibrillation is applying a strong electrical signal to reset the heart. Hopefully the SA node will start firing again. Okay, so features of the cardiovascular system. So your learning outcomes here are to understand how the pulse relates to heart rate, explain how blood pressure differs in veins, arteries, and capillaries, and distinguish between systolic and diastolic pressure. So blood pressure is the pressure that blood exerts against a blood vessel wall. It's highest in the aorta, right next to the heart. It gradually decreases as it flows through the vessels in the body. And then a pulse is surge of blood into an artery, which causes the wall to stretch and then recoil. And this is usually measured in the radial artery at the wrist or carotid artery in the neck. And the measurement of the heart rate averages 60 to 80 beats per minute. So blood flow is regulated. So contraction of ventricles creates blood pressure, which propels blood through the arteries. And this is measured with the sphygmomanometer, which is in the brachial artery of the arm. And so here's an image of that. So we used to measure with sound using a stethoscope. And so you can hear the arteries open and close, and then this will give you a systole and diastole number. Okay, but nowadays it's all automated. Okay, so this will give you systolic pressure, the highest pressure when blood is ejected from the heart, and it'll give you the diastolic pressure or the lowest pressure when the ventricles relax. And so the average is 120 over 80. And hypertension is considered high blood pressure. Hypotension is considered low blood pressure. And so here's a chart showing you the normal adult blood pressure. And so you can take a look at this. But again, the average is 120 over 80. Okay, so blood flow, blood pressure decreases as it flows away from the heart, is slowest in the capillaries to increase the exchange of gases, nutrients, and waste, and is adjusted by the precapillary sphincters. Okay, so here's an image showing you the pressure. And what's to remember here is that pressure is highest in the arteries and then decreases as it goes towards the veins. Okay, so blood flow continued. So blood pressure is very low in the veins, so it doesn't contribute much to the movement of blood. Venous return is dependent on 3 additional factors. So we have a skeletal muscle pump, which is dependent on skeletal muscle contraction. We have a respiratory pump, which is dependent on breathing. And then what's important to remember is that there's valves present in the veins. Okay, so here's an image of the skeletal muscle pump. So contracted skeletal muscle pushes blood past an open valve, and then the closed valve prevents backward flow of blood. Okay, so there's 2 cardiovascular pathways. So your learning outcomes are to compare blood flow in the pulmonary and systemic circuits, identify the major arteries and veins of both the pulmonary and systemic circuits, compare the oxygen content of the blood in the arteries and veins of the pulmonary and systemic circuits, and explain the location and purpose of the hepatic portal system. So blood flows in 2 circuits, the pulmonary circuit and the systemic circuit. So the pulmonary circuit circulates blood through the lungs. The systemic circuit circulates blood through the body tissues. So that's imaged here. So we have, again, the red shows oxygenated blood and the blue shows deoxygenated blood. You can see a lot of the function of the cardiovascular system is to exchange oxygen and carbon dioxide with a lot of different tissues, as well as remove waste. So the pulmonary circuit, again, is exchanges of gases, does oxygen and carbon dioxide. So the pulmonary circuit, the right atrium pumps deoxygenated blood into the right ventricle, which pumps it into the pulmonary trunk. The pulmonary trunk splits into right and left pulmonary arteries, which go to the lungs. In the lungs, the pulmonary arteries branch into arterioles, which lead to capillaries. And so this is where gas exchange occurs, at the capillaries. The pulmonary capillaries lead to venules, which merge into the pulmonary veins. The four pulmonary veins empty into the left atrium. The pulmonary arteries carry oxygen-poor blood, and the pulmonary veins carry oxygen-rich blood. So the systemic circuit exchanges with the interstitial fluid. So the systemic circuit, the left ventricle pumps blood into the aorta, which gives off branches to all tissues of the body. Arteries branch into arterioles, which lead to capillaries. Capillaries lead to venules, which drain into veins, which lead to the superior and inferior vena cavae. The vena cavae empty into the right atrium. So here's an image for you to look at, showing you the major arteries and veins of the systemic circuit. So the systemic circuit continued. Usually blood flows from the aorta into an artery that supplies an organ, then through veins back to one of the vena cavae. This is aorta, renal artery, kidney, renal vein, and then back to the inferior vena cava. However, there are special routes that don't follow this pathway. For example, the hepatic portal system. So the hepatic portal system is specialized for blood filtration. So the hepatic portal vein brings nutrient-rich blood from the digestive tract to the liver. The liver synthesizes blood proteins from the amino acids in the hepatic portal vein and stores the glucose as glycogen. The liver also removes toxins and pathogens that enter the blood through the digestive system. Blood is drained from the liver into the hepatic veins, which drain into the inferior vena cava. Okay, so exchange at the capillaries. So your learning outcomes here are to describe the process that move materials across the walls of a capillary, explain what happens to the excess fluid that leaves the capillaries. So two forces drive fluid in and out of capillaries. So blood pressure drives fluid out of the capillary, mainly at the arterial end of the capillary bed. This fluid contains everything that blood contains except cells and plasma proteins. And then osmotic pressure draws water into the capillary by osmosis, mostly at the venule end. Some tissue fluid enters lymphatic capillaries and becomes lymph, which is eventually returned to the cardiovascular system. Okay, so that's shown here. So at the arterial end, there's blood pressure is high, higher than osmotic pressure, so the net pressure is out. And then at the venous end, osmotic pressure is higher than blood pressure, so the net pressure is in. And then here's an image showing you with the lymphatic capillaries as well. Okay, so moving on to cardiovascular disorders. So your learning outcomes here are to explain the underlying causes of cardiovascular disease in humans, summarize how advances in medicine can treat cardiovascular disorders. So cardiovascular disease is the leading cause of early death in Western countries, and these are due to disorders of the blood vessels. So we have hypertension or high blood pressure, and atherosclerosis often lead to stroke, heart attack, or an aneurysm. So hypertension or high blood pressure is a systolic pressure of 140 or greater, or a diastolic pressure of 90 or greater. It's considered a silent killer because there are few symptoms until it causes kidney failure, a heart attack, or stroke, and treated with diuretics, which increase the production of urine and other drugs. So atherosclerosis is a buildup of atherosclerotic plaque in the walls of blood vessels. Plaques narrow blood vessel diameter, decreasing blood supply to tissues. This can cause clots to form a roughened walls of the arteries. So a thrombus is a clot that is stationary. An embolus is a clot that detaches and moves to a distant site. And then a thromboembolism is an embolus that has become lodged in a blood vessel. So that's shown here. You can see this clot here consisting of fat and cholesterol crystals, and you can see that this is decreasing the volume of the blood vessel, making it difficult to bring oxygen and carbon dioxide to different tissues. And this can eventually lead to a stroke or cerebrovascular accident, also known as a CVA. So it occurs when a cranial artery is blocked or bursts. So part of the brain dies due to lack of oxygen, and symptoms may include numbness of hands or face, difficulty speaking, and an inability to see in one eye. So a heart attack or a myocardial infarction, MI for short, is part of the heart disease, part of the heart dies, due to lack of oxygen. So this is caused by a blocked coronary artery, and it can begin with angina pectoris, or a pain in the chest from a partially blocked coronary artery. And these can be treated with drugs that dilate the blood vessels. So an aneurysm or a ballooning of a blood vessel, most often the abdominal aorta or blood vessels in the brain. Atherosclerosis and hypertension can weaken a vessel and cause ballooning. If a major artery ruptures, death can result. So treating clogged arteries, you can do a coronary bypass operation. So a vein from the leg is taken and used to bypass a clogged artery. We can do gene therapy or injection of the gene for vascular endothelial growth factor, so VEGF, which induces the growth of new vessels. Then there's no need for bypass surgery. And then angioplasty, a tube is inserted into the clogged artery to insert a stent or a mesh cylinder to hold it open. And stents are usually coated in drugs to dissolve blockages. Okay, so here's a treatment for atherosclerotic plaque. In the coronary arteries, you can see you can put this stent in here and inflate this balloon to help open up the vessel so that blood can flow normally. Okay, so heart failure, the heart no longer pumps properly. So there's a couple different treatments for heart failure. You can wrap the heart to prevent enlargement. You can implant a cardioverter defibrillator or an ICD that corrects an irregular rhythm. You can also do a heart transplant. You can inject stem cells to repair damaged heart. You can also implant a left ventricular assisted device, which is battery powered to assist the heart. Or you can do a total artificial heart, which is a temporary solution. And so that's imaged here, showing you the artificial heart. And that'll be into the material today. So I saw there was a question in the chat about exam 1. Yeah, so there's still some questions to be graded on the exam, if you're wondering why your points aren't adding up correctly. Is there any other questions? All right, that's it for me today, you guys. Have a great day.
Thank you, bye.